in D.C., leaders say area hospitals and emergency responders are ready should a case of Ebola be diagnosed here.
Now, this comes as we get a look at what it's like for those who are close to the disease that's generating so much fear around the globe. D.C. Bureau Chief Sam Ford with the story.
After several Ebola scares here in Washington in recent weeks, the director of D.C.'s health department invited reporters to what he called a conversation on Ebola.
There's no need for panicking. There's no need, and I don't want the people in D.C. to be panicking.
He said it is not a mystery disease. He's met with all the hospitals in D.C., and he said all the hospitals with emergency rooms know what to do.
This is not an airborne disease, and if we follow all hazard protocols and fluid protection for fluid and body fluids of the patient, we should be fine. We should be fine.
Dr. Garcia said as he's moved around the city, he's concerned about fear and stigma, citing one man's questions to him.
His wife would not allow him to swim in the pool because there were 2 Africans in the swimming team. So we don't want that.
It's a problem for a Liberian-born Saminde Lloyd of D.C. who volunteered as a media spokesman for the Dallas family of Thomas Duncan, who died of Ebola. Although all were quarantined before she met them, when she returned to her volunteer job at a D.C. senior center.
And those seniors were running away from me. And they went to the management office and told the management that they didn't want me in the building.
We're fighting here 2 things. We're fighting the real science and the fear. And I think right now fear is in the forefront.
Saminde Lloyd says she is returning to Dallas next week. The fiance of Thomas Duncan, Louise Cho, and her relatives are being released from quarantine after 21 days. So far, disease-free. Reporting from Northwest Washington, Sam Ford, ABC 7 News.
Okay, Sam, thank you for that. Well, the second largest nurses union in the country voiced its concerns today about the safety of the healthcare workers on the front lines treating Ebola patients. Nurses gathered just blocks from Capitol Hill, and they are calling for new infection control protocols at all health facilities, as well as teams trained to treat suspected Ebola patients.
This should be a wake-up call. This is a life-threatening disease, but it is eminently containable, but only if we include nurses and frontline care providers in the development and implementation of Ebola response plans.
Several nurses said today that they have been restricted by budget cuts for years, and this should be a sign to federal and state health officials that there needs to be more funding for public health systems.